According to the CBO, Medicaid will cost the federal government $5 trillion over the next 10 years, with as much as $638 billion of that directly linked to the expansion of Medicaid from PPACA. Recently, Governor McDonnell laid out the need for vast reform to make Virginia's Medicaid program more cost-effective before the Commonwealth can consider an expansion of those benefits and that program. The governor has laid out 5 tenets for Medicaid reform. 1, service delivery through efficient market-based system, including more managed and coordinated care. 2, reducing financial burdens to the state by getting an assurance from the federal government that the expansion will not increase national debt. 3, maximize the waivers that currently exist to achieve administrative efficiencies through streamlining of payment and service delivery. 4, obtain buy-in from healthcare stakeholders in the state for statewide reform. And 5, achieve greater flexibility by changes to federal law, including more value-based purchasing, cost-sharing, mandatory engagement in wellness and preventive care, the development of high-quality provider networks, and flexibility around essential health benefits. Virginia Hospital and Healthcare Association has said that they will cooperate. The reforms that Virginia is now discussing are on a par or similar to what we have discussed here in the Energy and Commerce Committee, at least on our side of the aisle. And that flexibility with Medicaid programs, I think many states desire. So, Mr. Archambault, do you agree with Governor McDonnell that we need to have these Medicaid reforms and that not only Virginia but other states should be exploring these types of reforms and that we should be a partner with them? If you could explain.
Yes, Mr. Griffin, I think the governor has laid out and put his finger on a number of the issues that exist in the current program, and this is a bipartisan issue. You have governors who have put in waiver requests that take over a year to get any response from the administration on whether they can move forward or not. So certainly I think both Republican and Democrats at the state level see the value of greater flexibility, and I think anything that Congress can do to grant that flexibility would be a move in the right direction.
And you say that there are Democrat governors as well as Republican governors who desire this flexibility?
That's true. I mean, we have one just south in Rhode Island in which they've been working on these issues for years, trying to get flexibility, and they got some additional flexibility to move forward.
And do you think that's because they sense that as the Founding Fathers did, that perhaps the individual states should experiment and find what works best, and then others can copy if they wish?
I think that's right. I mean, we even have an example in Connecticut with a Democratic governor in which they expanded recently in Medicaid, and they found that it was more expensive than they initially anticipated, asked for flexibility from the administration, and it was denied. So I think there certainly is a need and a recognition on both sides of the aisle at the state level of this issue.
Mr. Capretta and Mr. Archambault, both, what do you think that we can do to better serve the states as they try to figure out ways to be more efficient? I'll start with you, Mr. Capretta, since Mr. Archambault's had a couple of minutes.
I think this year is a historic opportunity to move ahead with some more Medicaid flexibility. Here you have an administration that would like the states to do a very large-scale expansion, which the Supreme Court said is entirely optional at this point. Many states are holding back thinking about it. I think they have a great deal of leverage, and you and the Congress have a great deal of leverage to say, before we do anything more to put more people into the program, let's come to a consensus about what the basic rules are for who's running what.
For those who may not follow Virginia politics closely, that's exactly what the Virginia General Assembly did, was they said, we're going to set up a special group to consider expansion that the President and the PPACA encourages, but we're not going to expand until we've seen reforms that make it so that we can afford to do that expansion. And so you're recommending that perhaps we take that Virginia model and see if we can help encourage other states to do that by giving them the flexibility.
I think there's a real pernicious effect. I worked in the administration, did a lot of Medicaid waivers in my previous job and in a previous administration. There's a little bit of an unusual and pernicious effect on one-off negotiations between an administration and a state. There ought to be rules that apply to every state that are fair to taxpayers across the country and not special deals given to some states over others.
All right, I appreciate that. I only have 6 seconds left. Mr. Archambault?
You know, I think a great example is welfare reform. that you had a lot of states figure out how to do it at the local level first, and then there were the same rules applied to all states.
And I've got to go, but I would be remiss if I didn't mention that Virginia led on that one as well. Thank you very much. I yield back, Mr. Chairman.
Chair, thanks, gentlemen.